Good morning. This is Lacey Nobles with the City of Lubbock. We will start our news conference in just a few seconds. Okay, good morning and thank you for joining us for the City of Lubbock COVID-19 news conference. Today we'll have updates from the Health Department, local health authority, our hospitals, and from the city. And today our panelists are Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, Chief Medical Officer of UMC, Dr. Mike Reagan, Regional Chief Executive of Covenant Health, Richard Parks, and Lubbock Mayor Dan Pope. And today we'll get started with Catherine Wells.
Good morning, and thank you for allowing me to update our residents with regard to our current COVID-19 situation here in Lubbock. I want to again assure our residents that the health department is working with our hospitals, doctors, healthcare providers, as well as the state health officials to ensure everyone has the most recent information and guidance as we continue to move forward. With this in mind, we want to remind the public to continue to stay at home, follow good hygiene practices, and when you're out, practice social distancing. Today, I'll update you on our current number of COVID-19 cases in Lubbock County. The health department is reporting 470 cases as of April 22nd. The department is pleased to see the number of cases, daily cases, remain steady. And this really is because of the continued collaboration with our community in following all of these guidelines. I regret today that I must again report additional deaths. The number of COVID-related fatalities is now at 39, and 35 of those individuals are associated with our nursing homes. We also continue to track our recoveries. There are 143 residents in Lubbock who are now fully recovered. Today, I also want to highlight the work of the individuals who are conducting the contact tracing in our department. Strong contact tracking is key to controlling the spread of COVID. Contact tracing or contact tracing includes interviewing those who are newly diagnosed with COVID, identifying where they were exposed, identifying their close contacts, monitoring those who were exposed with regular checkup phone calls. And then if a person who we're monitoring develops symptoms, our health department staff are also working to facilitate that testing. To date, the health department has followed over 650 individuals through this monitoring process. Of these, 92 people are either lab confirmed or presumptive positives. And this is good because it's kept individuals from being out in the community when they were possibly infectious. At the health department, there is a dedicated team of 25 individuals who are making these calls and working to stop the spread of this virus in its tracks. This concludes my update for today, and I will now turn it over to Dr. Cook.
Thank you, Catherine. Pardon me. I want to show you guys a slide. Lubbock overall has done a very, very good job. Let me share my screen with you for just a moment. So this screen shows the doubling time. Now remember, we talked about the doubling time before. The doubling time is the amount of time it takes for the number of positive cases to double. And so we were really concerned a couple of weeks ago, that our nursing home population was at significant risk. It's always at risk. And so, but we put in great efforts to really shut down infection rates in those facilities. And so if we look at this blue line right here at the top, we're now at about 72 or 73 days for our doubling time. That's amazing, because shortly before that, around the 4th of April, we were down here at 5 days or so. But now we're up here to around 70 days. Overall in Lubbock, this black line, the entire cases in Lubbock, we're at about 25 days it takes to double the number of cases that we're seeing. This is fantastic news, and I want to pat you guys on the back for this. As a result of people doing their social distancing and washing their hands and wearing their face masks in public, and staying at home as much as possible, we've really made these curves start to skyrocket. Now, what I want to bring to your attention is, and the mayor and his team, his economic recovery task force, are putting together a wonderful plan for us to slow down or decrease the orders that we have. And so where we can get out a little bit more. Our concern is at the health department is that this graph could suddenly nosedive. But I know that you guys have done a great job so far. And with the orders and the economic recovery task force that the mayor and his council have put together, I know that we will continue to push this curve up. However, if that curve nosedives or takes a sharp turn downward, we're going to have to back up a little bit and reassess, because we can't flood the system. We can't flood the hospital system. We don't want our nursing homes and assisted living centers and long-term care centers to get overwhelmed. And so we are certainly, this is evidence that we're certainly headed in the right direction. And each of you Lubbockites should pat yourself on the back. This is wonderful news. And I'm really pleased with this. So one of the things that has also come up is, again, discussions about facial coverings. So there's 3 types. One is the N95 mask, which is sort of a rigid mask, and it does the most and the greatest filtration of particles, 95%. That's what that 95 stands for. 95% of the particles it can filter out. The next one is a surgical mask. You've seen these on TV shows, and many of you may have these. Let's save these for the healthcare workers. They typically have a little metal band at the top that helps it form around the nose. And then the other are just facial, we'll call them facial coverings. Typically, it's 2 layers of cloth sewn together, and then you can put elastic bands. I prefer the tie-on strings because I don't like it so tight. But some of you may complain that it fogs up your glasses, but that's easy to fix. So you put the facial mask covering on, and then you use a piece of gentle tape, like paper tape, and you just put it right across the top. So it doesn't pull on the skin very hard, but it makes a nice seal. And then now it doesn't fog up the glasses. So these are very comfortable to wear. And so I went on Google for some DIY how to make a facial mask. And many of you are very good at sewing. I am not. I can sew up a laceration, but I'm not very good at this kind of sewing. So in just a matter of microseconds, there were a billion hits, over a billion hits on how to make facial masks. I encourage you, as we continue to relax our standing orders for social distancing and opening up the stores in Lubbock, let me strongly encourage you to wear some kind of facial covering. And it's not to protect me from getting infected as much as it's protecting me from giving that infection to somebody else. Giving that infection to somebody else who may not tolerate the infection as well as I might. So please wear facial coverings when you're out in public. You guys have done a great job. I think that slide shows what a wonderful job you guys have done. Keep up the excellent work, and I'm really proud of the mayor's work on the economic recovery. So we're going to do well. Thank you, and that concludes my portion. Back to you, Lacey.
Thank you, Dr. Cook. And now we're going to have some updates from our hospitals with Dr. Mike Reagan, Chief Medical Officer of UMC, and Richard Parks, Regional Chief Executive of Covenant Health. And we'll start with Dr. Reagan.
Thank you, Lacey. Happy to be here this morning with y'all and give you an update on how things are going at UMC. We're doing well here overall. I have a few numbers to share. So currently we have 16 inpatients, and that is down from a peak of 22 inpatients that were positive for COVID back on April the 12th. And we've seen kind of a gradual decline from that date to today. We continue to have vigorous testing in our drive-up testing center on the south part of our campus. We've screened almost 5,000 cars. Our COVID call line has received over 4,000 calls. We are very excited about a new therapy available in the community. We are providing convalescent plasma treatment in conjunction with Dr. Burke and the School of Medicine at Texas Tech, and have 5 patients enrolled in that national trial. Speaking of testing, we are now able to perform tests on 4 different inpatient platforms for the PCR test that is a nasal swab. We have capacity for just under 800 of those tests in terms of reagents available, so we're pleased with that capacity. We are moving forward on blood testing for COVID antibodies, and that should be available toward the end of this week. So we're looking forward to adding that to the testing armamentarium. As the case volume has declined and as the governor has made changes regarding his orders, we are beginning elective procedures. We started cardiac procedures yesterday and plan to do GI procedures starting on next Monday. We will not be doing elective surgeries until May the 9th, but plan to do those as soon as that time comes. One of the changes we're going to be making starting next week is a loosening of the restrictions on visitation. Previously, we had 0 visitor policy with exceptions, and we'll be moving to a policy of 1 visitor per day per patient. We're excited that we will be having a Park and Pray event on this Saturday at 8:30. And this is to support our staff as we're continuing to address the COVID crisis. And that's all the updates I have, so thank you.
Thank you, Dr. Reagan. And now we'll hear an update from Covenant Health with Richard Parks.
Well, thank you very much. I too will provide some statistics and then move into some general comments from the Covenant Health perspective. I'll just say from a cumulative number of total COVID cases that we've had is 31. Currently today, we only have 11 patients on our COVID unit and 4 patients in our COVID ICU unit. As far as testing across our fever clinics and other testing capabilities across the region, we've done about 2,200 tests and have 194 positives out of those tests. As far as general comments, I would say that we're confident based on our stockpile of personal protective equipment, or you may be familiar with the term PPE, that we can resume all cases, including elective cases, for patients that need Covenant Health Ministries. We will start those as I speak. We're prepared to start cases today. We've had multiple phone calls from our staff to physician offices with their schedulers, face-to-face meetings and phone calls with our physicians to determine what type of cases need to be stratified in terms of emergent, urgent, elective. Our staff's done a great job working with physicians in the region to do that. So we are opening elective cases as I speak, and we will be testing each patient preoperatively before their procedure as an additional safety precaution for the patients, the staff, and the physicians. All of our caregivers, if you weren't aware, go through a health screening each day prior to beginning their work. And also if they go off campus from the ministry, they have to go through another health screening when they return. All people who enter our hospitals and clinics, including physicians, nurses, and visitors, have to go through that same procedure. If someone were to show with a fever at that screening, they're not allowed to come in the hospital or the medical center at that time. As an additional precaution, we implemented further stricter guidelines with our surgical and environmental services teams this past week, preparing for elective surgeries again, and they're to follow an even stricter process for sterilizing and cleaning rooms of any type, including the general hospital facilities. Just from a COVID specific standpoint, I thought you might be interested. First, we've isolated every COVID patient into a COVID unit or a COVID ICU unit since we began this process, including our emergency department has a separate pod for COVID related cases. I thought you might find this statistic maybe the most interesting. I've talked to a lot of people in the community, obviously, about the COVID situation. And the most interesting statistic that they find in my discussions with people and staff is that less than 3% of our hospitalized patients are COVID positive. Let me repeat that. Less than 3% of our hospitalized patients are COVID positive. It's interesting to me, and I'm thankful we're doing these press conferences because I want the word to get out that the predominant number, significant majority of cases that we have in patients are not COVID positive. Those are separated from the general population, both inpatient and outpatient. The other interesting statistic to me is as we've gone through this process, of those patients, of that only 3% that's positive for COVID, 81% of those patients have either no symptoms or mild symptoms and recover very nicely. So I don't want to minimize the seriousness of the situation, but I will tell you if you look at those types of statistics, Lubbock is in a very good place with this situation in terms of our medical capacity, but also the way that these cases are being handled. So as far as we're concerned, based on the governor's press conference last Friday, all Covenant Health Ministries or hospitals and medical centers are resuming business and services as usual. But obviously the unusual part is there are much more necessary precautions that we're taking with patient admissions and patient surgery. So again, from a Covenant Health perspective, we're excited about treating you as we always have as of this moment in our clinics and our hospitals and medical centers with these additional precautions. But we're here and happy to serve you and thankful for the press conferences. Thank you very much.
Thank you, Mr. Parks. And now we'll hear from Lubbock Mayor Dan Pope.
Good morning. It's great to be able to share with you today. I want to start by telling each of you that our first responders, our healthcare professionals, the men and women that are providing our food supply, and the families and loved ones, families and friends of those that have been impacted by COVID-19. You all remain in my thoughts and my prayers. I'm also very thankful for Dr. Cook, for his efforts, for Catherine Wells and their efforts. And you just saw UMC and Covenant. I can't brag on them enough for the kind of partners they've been and for who they are every day and the way they stand strong for our community and importantly for our region. I'm thankful for their preparation and their execution and their willingness to communicate and be out front. It's very important to me that we get business restarted. In fact, I'm pleased that Mr. Parks talked a little bit about his plans as well as Dr. Reagan did their plans for both UMC and Covenant with elective surgeries. I've talked about it before, but it's a fine line. We're navigating between saving lives and livelihoods. And I'm so thankful for our Economic Recovery Task Force under the leadership of Councilman Steve Massengale and Robert Taylor, the CEO of United Supermarkets. They began meeting on Monday afternoon. They've met every day since then. They meet again this afternoon. The entire committee meets tomorrow, and they will have an initial recommendation on restarting, getting things started to our city council for our consideration at our meeting on Tuesday. Now, we'll continue to make decisions that are based on fact. We'll use common sense and all the information that we have available. Our decisions will continue to be based on values and our principles. I don't have all the answers. I'm thankful that I get to collaborate with experts. I get other people's ideas. I'm able to search out best practices. I'm able to explore the new technologies that are being created actually on an hour by hour kind of time frame. And that allows us to look for what I believe are the best solutions. There's a lot of risk involved in the decisions that we make, but I believe trust is very important. And I want to make certain that you know that I trust our citizens to make good decisions. And I believe our citizens trust us. And so much of trust is about us sharing information. And that's what this effort is about. And I'm about ready to share a bunch of data with you that I think you'll find interesting. But before I do that, I want to talk about hope. I believe hope is critical. And that hope is grounded in who we are as Lubbockites, and our love for each other, in our independent spirit, in our ability to get things done, in our creativity. We together will work our way back to prosperity. We'll do that together. We'll begin that as soon as possible. I want to share my screen with you now. We will today post on our COVID-19 site on the City of Lubbock website a number of slides that will provide demographic data. This is something that's been asked for, and we wanted to make sure that we had it right before we were able to put it up. And so it will go up today, and you'll see that we will provide case information by ethnicity. We'll talk about our deaths by sex and age, also by ethnicity. We will show you where the COVID-19 cases are in our community overall, and that's countywide. We'll also show you where the community-acquired cases are countywide. Finally, I want to get to the three areas that I told you on Monday that are important to us as we study, and Dr. Cook alluded to this a minute ago. These are the three metrics that we're studying as we make decisions to restart our economy. First, active cases by day. So active cases are total cases less recovered and deceased. Now, if you'll look back for the last week, you'll go back to this time a week ago, you can see that our line has very much flattened out. Second, we are looking at new cases by day. This is the one that a week ago had us concerned. But in the last 6 days, our new cases have decreased and the trend is correct. So in that period of time, the fewest cases we've reported is 6. The most we've reported is 16. We want to see this continue to trend down. Finally, the hospital data. And that is the capacity of the hospital versus hospitalized patients. Both Mr. Parks and Dr. Reagan spoke to this, but you can see how much capacity we have and why we feel good about, number one, elective surgeries beginning, as the governor has allowed, as well as restarting our economy. Hold on one moment as I figure out how to quit sharing my screen. Okay, I think I'm back now. All right, that concludes my comments. This information will be posted today on our website, and I hope you'll look at it. Continue to suggest the information that you feel is important. We want to provide the information that you need to feel safe, first of all, and more importantly, to completely understand COVID-19 as it impacts Lubbock and Lubbock County. Lacey, back to you.
Okay, thank you, Mayor. We'll now open it up for media questions, and here is today's order of media questions. Matt Dotre with Avalanche Journal, Adon Rubio with the Daily Toreador, Christy Martinez Garcia, Latino Lubbock, Karen McKay, KCBD, Olga Aguero, El Editor, Terry Furman, KLBK, Matt Stell, KMAC, and Blair Sable with the Fox 34, and Casey Ellingson with Texas Tech Public Media. So we'll start it with Matt Dotre.
Thank you, Lacey. Hey, everyone. Okay, so the mayor showed that zip code map briefly. It looked like most of the cases were in South and Southwest Lubbock. I guess this question is for Catherine. Like, why do you think that is? And is that taking into account the nursing home populations?
Matt, the first slide that was shown includes the nursing home data. The second slide is actually the community spread. And we really need to spend some more time analyzing the data to look at some of those different trends. So I don't have a good answer on why one area is higher than another.
Okay, and is Mr. Parks available? Is he still?
Yes.
Okay, very good. Mr. Parks, I guess I'd just like to hear a bit more from you, kind of about where you're coming from. I guess the figures you discussed made it kind of seem like you didn't think this virus was too big of a threat. Like, do you think society as a whole is overreacting? Is that why you shared those figures that you were discussing?
Thanks, first of all, for the question. No, I wasn't trying to minimize the seriousness of the situation. I can only speak to our ministry and what we are experiencing. As I said, there were only 3% of our total population that are COVID positive inpatients. And of that 3%, 81% has either no symptoms or mild symptoms of COVID. If you try to extrapolate that to the society as a whole, I think it personally, in my opinion, as a non-clinician, I would say it depends on the geography and the epicenter of where the multiples of COVID cases are occurring. Certainly Lubbock, Texas is not New York City or LA or even Houston for that matter. So I don't think that we're seeing any more or less of COVID cases based on the amount of testing we're doing. But I do think that the patients that we've seen, at least in our ministries, aren't experiencing the seriousness of the problems in the whole, not individually. We have had some very serious cases, obviously, but in the whole, they haven't been as serious as some other hospitals and locations I've read and heard of.
Now we'll go to Adon Rubio with the Daily Toreador.
Hello, everyone. I guess really just for my first question, it's kind of regarding yesterday during the city council meeting, it was mentioned that Lubbock's testing capacity is expected to increase due to just the new testing sites we're getting at Patterson Library and at one of the Walmarts. So with that being said, I was wondering if the issue of the limited number of testing kits is still a major issue, whether it be for the current testing sites or these upcoming testing sites.
You know, I think, Don, I think until we can test everybody, it's still a challenge. We want more testing. It's part of recovery. We want to know where there are hot spots and where we can mitigate those quickly, as we've continued to do through the health department and working with the public health authority.
All right. Well, I guess just as a follow-up to that, I was just going to wonder as well, with these new testing sites, are there any kind of rules that some people should follow in terms of where they should enter into the testing site, how much, what they should expect to, what information they should prepare, and really how much can these testing sites test people at one time?
Well, the testing sites will, the Walmart testing location will operate similarly to the two that are currently set up. I do believe that they would like people to schedule online for that one. And that the one that will start next week at the Patterson Library, we'll have the process for that one worked out, and we'll communicate that early next week.
Okay, and now we have Christy Martinez Garcia of Latino Lubbock.
Thank you for sharing that information. And I know that the analysis that you provide, I look forward to learning more about that, but what breakdown or how do you plan to use those figures to address future situations, like maybe testing site placements and whatnot? And this is for Catherine.
I think one of the first things we did was that we saw that there were fewer positives in some areas that did not have testing sites. And that's part of what drove the health department to launch the testing site that will open over at the Patterson Library. And we'll continue to look at where our testing sites are placed throughout the community to make sure that there's access throughout all of Lubbock.
Thank you. My follow-up question is the city preparing any marketing campaigns and messages to proactively groom citizens in case that a second wave of COVID-19 occurs in the fall and winter, predicted to be even more challenging than the first time?
So a big part of our recovery efforts is communication, and there is a subcommittee of the Lubbock Economic Recovery Task Force that's focused just on communication. It'll be our efforts to restart and doing that in a safe way. And we will hopefully work our way out of this. And by the time the flu season comes back in the fall, be very well prepared for that. Our efforts, as I said earlier, are not to restart so quickly that something flares up. We want to make certain that we do this the right way, so we restart one time and we safely grow back to prosperity and safety.
Thank you so much.
Thank you.
Okay, now we have Karen McKay with KCBD. Karen? Karen?
Can you hear me, Dr.? All right, Dr. Reagan, can you hear me?
Yes.
About the antibodies that are expected at the end of the week, the antibody test. If 80% of people have no symptoms or mild symptoms, how do you know if you need to get that antibody test, and what is going to be the procedure for that?
Well, so I think the first place we're going to start with antibody testing is employees and medical staff to identify those that think they may have had the infection. I think as we expand that capacity, we can do broader testing. The mayor had said until everybody can be tested, we don't have enough tests, and we're not there yet, but we are beginning that process. I think the other place for the antibody testing is to identify those who have gone through the illness and recovered, who could potentially be donors for the plasma therapy that we discussed.
And as far as general testing, we have so many testing sites opening up now. How can you be sure that maybe one is more accurate than another, since they're testing in different ways with a nasal swab and so forth? Are there false negatives that we have to be concerned about?
Sure. Always with any test, there's the possibility of false negatives and false positives. It's one of the tools to help you decide is the pre-test probability. So if you really think the patient has the illness or doesn't have the illness, the test can be more useful. That's just a statistical approach.
Okay, and now we're going to Olga Guerrero with El Editor.
Good afternoon. Can you hear me?
Yes, ma'am. We can.
Okay. All right. It's great that we're together and talking about all this, and I can't just put myself to ask just one or two questions, but I want to sort of give like a quick little analysis of what I received and what I hear are people calling our offices for different reasons, and we're trying to educate them and share our information that we receive from y'all. In order to help each other or help everything going on, is we don't want to overwhelm our facilities, according to Dr. Cook, and by his graphic showing that yes, we're going through a level, But then yet the concern is, are we doing enough testing in order to get these percentages? And then in order for the antibody to be benefited, are all health personnel of all capacities being tested? And for sure, since there's a great concern as for the nursing home and the rehabilitation homes, if not, should that be one of the main things to be considered, is to testing? And the other thing that I want to tie in with this is the staff, the people that are helping the health department in doing the community investigation. She indicated there was 25 in the team. Do you feel like if we maybe go through a little spike, will you be able to handle what needs to be handled with 25, or you're considering to increase that? Thank y'all.
Catherine, why don't you talk about the health impact on the health department?
Sure. We've been growing the team that has been doing the investigations. Typically on a normal year, we have about 3 people doing investigations. We've pulled in staff from our clinical areas, and then we're also pulling in additional city staff whose maybe job duties are a little less because of the different shutdowns, actually coming in and helping with us. So I really think we have the capability to increase those investigations and keep up if our case counts increase.
Thank you.
Olga, let me help answer your question about the antibody testing. That's a relatively new test. There's not many FDA approved antibody tests that are out there. They have, even when UMC or Texas Tech or other individuals, Covenant gets their antibody test machine, that machine has to be validated, and that takes more than a couple of days to do that, to make sure that it works correctly, that it's giving us the expected results that it's supposed to give. So a true positive is a true positive, and a negative is a true negative. So right now, because our antibody testing capabilities are somewhat limited, it's like Dr. Reagan said, we're limiting that test to the frontline individuals that need to return, or those individuals that need to be released to a long-term care facility, to make sure that those individuals are not infectious to somebody else.
Furman with KLBK.
Good morning, everyone. My question is this. And I appreciate all the graphics. Those are fantastic, by the way, and all the information. But I want to know, in the beginning, we were talking about which cases were, low, medium, and high risk. We stopped talking about that. Do we feel like all of them are low, or are we just not saying, what is a high risk case?
I'll go ahead and take that one.
Okay.
The categories of low, medium, and high were referring to exposures. So those were individuals that were out in a public place where the health department couldn't figure out who they might have been in contact with. And based on that time, or how many people they might have been around, we classified those levels of cases. Now that we've seen so many of people staying home, when they get sick, they haven't been out and about as often. So we're not seeing those same community exposures that we were seeing early on.
Okay, thank you.
Lacey, you're muted.
Sorry. Next, we have Matt Stell with KMAC.
Excuse me. Thanks so much, Lacey. First off, this question may be for Ms. Wells. We, from some of our other sister stations across the state, that they were getting some concern from people saying, hey, I don't have a car, but I feel like I should get tested. I really don't have a way or a form of transportation to get to a testing center. And I imagine that may be the case for some folks here in Lubbock. So can somebody answer me, or kind of give me a response on what do we say to folks who may not have a way, or may not even have a way to get tested? What should they do?
We've definitely thought through some of that. Some of the goals are to have testing sites closer to individuals' homes. We will have a walk-up option at the Patterson Library We've also talked about the idea of going out and having a team of nurses that can go out and test individuals, kind of a smaller testing site. And then for individuals that, such as when we've had to go into the nursing homes, we've actually sent nurses there to do the testing. So when people are at high risk, we've actually gone out to them.
Catherine, would you please remind people how they would get in touch with you if they find themselves in this situation?
Yeah, and anybody's welcome to call the health department, 775-2933. If you hit option 1, that gets you to our call center. That's the best way for the public to get that type of information. And our goal is to help those who need to get tested. And if you're struggling with, quarantine or having other types of issues associated with COVID, please call the health department first, and we'll get you to the right place.
And one last question for Mayor Pope. Mayor Pope, you probably saw that a lot of cities, maybe some other states, are now moving from stay at home to safer at home, kind of pulling back on some of those more stricter restrictions, but still encouraging those to stay at home if need be. What do you think about that?
Matt, we're going to stick with our order and the governor's order. We're lined up with the governor, I think, very closely. There have been some other cities that have interpreted it different than we have. I think some of them wish their numbers looked as good as ours do. I think we are going to be in a position to reopen and reopen safely. That's been the goal from the very beginning, and we're going to stay the course. I look forward to getting the recommendations from our recovery task force. And certainly I'll continue to listen to our health professionals and others as we make these decisions.
Now we're going to go to Blair Sable, Fox 34.
Hi all, good afternoon. So my first question is for Catherine Wells. So you mentioned the increase in employment, or the increase in the people who are doing that contact tracing. I was wondering if that continues past the point when a person who tested positive is considered fully recovered. Do they do follow-ups, to check up on them to see if they're still doing well? We've seen some reports that, people who have tested positive in other places, other countries, and recover test positive again. So I'm wondering if there's anything being done with follow-ups from the health department.
From the health department perspective, we follow up with individuals through their entire quarantine and isolation process. Each individual is assigned a case manager type person. And when we end that quarantine time or isolation, we encourage them, if they develop any other symptoms or concerns, to contact the health department, and we'll move forward from there.
Okay, thank you. And then my second question is going to be for Dr. Reagan, if he's still there.
Yes.
I was hoping if you could talk a little bit about the plasma treatment. I know it's very new, at least for COVID-19, but have we done this before for other diseases, and what's the hope with that?
So it is an investigational treatment. So there is a national trial to investigate the impact of using it. And the idea is that patients who have recovered from COVID have developed antibodies that can fight the virus. And so you're taking plasma from them, from their bloodstream, and then transfusing it into a patient who has active COVID to try and fight the infection. The idea of antibody therapy has been around, and so it's not novel in terms of that. But the treatment for coronavirus, we don't know what the results are going to be. So this really is a research protocol.
Last question is Casey Ellingson with Texas Tech Public Media.
Hi, I was wondering if there is a possibility. I know with the task force, one of the areas that they're looking at is education. And I was curious if there's a possibility of schools coming back in session this semester or in the summertime.
Casey, the task force is working. There is an education subcommittee. The governor has already said that there will be no public or private school K-12 through the end of this semester. I think the higher ed community has done the same thing. I think a number of the universities have made announcements around their summer schedules. I would tell you that we are working closely with our universities, and they want to reopen as soon as they feel like they can safely do so. And we will continue to support them and be part of that decision-making process.
Awesome, thank you.
Okay, and that concludes our news conference for today. And thank you for joining us, and thank you to our panelists today. And we'll see you next week. Have a great day.